Thank you. I would say that, Madam Secretary, you have about a $580 million request to root out Medicare waste, fraud, and abuse, and you're running around an 8-to-1 ratio of dollars provided to dollars saved, which is good. But my hope is another thing that with Ranking Member Shelby and the Chairman that we're working on is to upgrade the very outdated Medicare card. This is the Medicare card as it currently exists, and has none of the standard upgrades that is available on IDs that are available today. Now, the department has funded a pilot project for DME equipment in Indianapolis, but it is totally outdated. It is only providing a mag swipe, which for $30 can be completely counterfeited. And I think does not represent the technology that's used by the federal government. This is a common access card of the U.S. military, and 20 million of these have been issued at a cost of approximately $8 each. What I just saw, because I was alert and had a lot of coffee at the time, is TSA agents have common access cards. So that whole 70,000-man agency now has this. The critical thing is not just the enhanced barcode, the optical variable ink, the picture, the signature, and the chip, but it is all on the back as well. As far as I know, DOD reports not a single CAC card has been counterfeited. Whereas this card's pretty easy to counterfeit, and the Social Security card being almost no barrier to counterfeit. We've agreed to team up and look at how we can use what's commonly available. And I'm hoping you take a look at, and I would ask you to reach out to Secretary Gates and his team, because I think if we had legislation that went forward to say to seniors, if you want to protect your ID and help root out waste, fraud, and abuse, for an $8 fee, you could get an enhanced Medicare card. And I hope we don't reinvent the wheel. I hope that in fact we reinvent nothing. We just expand the CAC card to 40 million seniors. But I wonder if you could explore that.
Well, Senator, I would love to have our team work with you on this issue. I do know that there has been concern that DOD's card is generations ahead of what we're looking at. It's as you might understand, a slightly different universe. They have a closed network system. We have about 1 million providers, so it's a challenge of different proportions. But we do have a new administrator who is specifically charged with program integrity at CMS, a position never created before. He's helping to build the new system and look at ways, and I would love to ask him to follow up with you and your staff, because we'd love to take a look at what you're talking about.
Well, I'm going to be very much in train with the chairman and ranking minority here, but I think that a lot of seniors in this age of identity theft would be pretty reassured.
Well, and we are trying, among other things, to establish the fraudulent card database, because it's not only seniors losing their card, but it's providers whose cards are, so we've got the challenge on both fronts. But I agree with you, things that could prevent that in the front end are what we're looking at. So I will have Dr. Budetti follow up with you right away. Thank you.
Thank you, Mr. Chairman.